Good evening and thanks for watching Times News. You're with me, Wanda Msisia. Face the headlines. President Lazarus Chakwera commits to fulfilling all campaign promises by the Tonse administration. Court hearing commences to determine whether two former ESCOM top officials have a case to answer on fraud and abuse charges. COVID-19 cases still on the decline. We have these and other stories. Please do stay with us. President Lazarus Chakwera on Wednesday told Parliament that the Tonse administration will deliver on all its campaign promises, including the duty-free week and the 14,000 kwacha passport fees. He was responding to a question from Kota Northeast Member of Parliament Martha Lungi Chanjo-Muhone. In his response, President Chakwera said the external shocks that have faced the economy
had to combine promises from the Malawi Congress Party, the UTM, as well as other alliance partners. He said priorities were given to promises that were common among all the parties in the alliance. Among others, President Lazarus Chakwera said the alliance prioritized issues of food security as well as making sure that Malawians have money in their pockets. He, however, said that does not mean that the alliance will not deliver on the other promises.
We shortlisted a few of the key promises that we have in common and put them on a flyer that we share with Malawians. But I promise you in office, we have been consulting among ourselves and engaging various MPAs, that is to say ministries, departments and agencies, on the best approach and timeline for implementing the promises that are unique to each manifesto, making sure to do so with sensitivity to the macroeconomic conditions of Malawi. The bad contractual obligations we have discovered are enforced from the previous administration, and the staggered implementation strategy we have had to adopt in view of the pandemic. Once we are ready to implement these promises, I will inform Malawians.
But in an interview later, leader of the opposition Kwagwanji said he was disappointed to see that the Tonse Alliance was not able to deliver on its promises.
It's a mixed reaction because there are some other questions which he has not tackled very well. For example, the issue that arose in the House to say that when is he going to implement the 14,000 kwacha passports and some other promises. So he was just a bit up there to say that no, we are still discussing, we are still planning on how we are going to implement this, and we are going. He says they are going to inform the nation later. But what I'm saying is, when a political party is making some promises during campaign period, I think it has always got ideas on how it is going to implement such activities when they come into government. So it sounds a bit weird to me to say that the president wants us to continue waiting, and I thought such implementation could have been done now.
This was the third time for Chakwera to go to Parliament and answer questions from members of Parliament since he ascended to power on June 28 last year.
Hearing to determine whether two former electricity supplier corporation of Malawi ESCOM top officials have a case to answer or not on fraud and abuse charges commenced on Wednesday at the Blantyre Magistrates Court. The two are former Chief Executive Officer Alexon Chiwaya and the company's former Director of Human Resources, Dafta Namandwa. Gary Samadi was at the court and has filed this report.
During court proceedings, the issue of whether ESCOM is a private or public-owned company was raised by defense lawyers. Lawyer representing Alexon Chiwaya, Wapona Kita, in his argument, referred to a past High Court judgment which said ESCOM is a private company, and so the accused cannot be prosecuted as public officers.
We will bring it to the attention of the court that there is a judgment from the High Court which says that ESCOM is a private company and not a public company. So why should we waste time attending to witnesses who are going to show that the public servants, when in fact ESCOM is a limited company? So asking that can the court determine the matter on a point of law? So we have agreed with the court that let the matter proceed. It will come to a stage of case or no case to answer. So at that stage, we should raise our issue.
However, state lawyer Zikondiantu Malunda argued against Kita's stand, saying ESCOM is a public company.
ESCOM is actually a public office, and as you heard in court, we will make the proper submissions at the particular or at the opportune time when we are called upon to make our submissions. So there isn't much really we can say now, apart from that. When called upon, we will make the necessary submissions to the effect that ESCOM is actually a public office.
Senior Resident Magistrate Elijah Daniels allowed the case to commence, during which the state lawyers paraded one witness. The case has been adjourned to Thursday at 2 p.m.
The number of COVID-19 cases is still on the decline in the country, with Queen Elizabeth Central Hospital indicating on Tuesday it had only 15 admissions within its isolation wards compared to over 100 admissions last month. This was revealed when Go Malawi, under the consortium of NGOs, presented personal protective equipment and other materials worth 8.4 million kwacha to help fight the pandemic. Llewellyn Impasa has more in this report read by Yanko Sewunda.
Under Disaster Risk Reduction Program, Go Malawi donated oxygen cylinders, examination couches, oxygen delivery tubes and other PPEs worth 8.4 million kwacha to Queen Elizabeth Central Hospital COVID Isolation Center at a function that took place on Tuesday. Speaking when handing over the donation, Health Coordinator for Go Malawi, Lazarus Chakwera, said Go Malawi is responding to COVID-19, aiming at supporting and mitigating the overstretched health system on resources regarding COVID-19.
Go Malawi is in a consortium with other NGOs like Save the Children, Trocare and Care, and they are responding to COVID-19 in the southern region. So one of the activities that we're doing is to buy equipment and some items that will be used in the emergency treatment units. So in Blantyre, the emergency treatment unit that we're using is Queen Elizabeth Central Hospital. That's where all the COVID-19 patients that are tested positive are admitted.
Receiving the donation on behalf of the hospital, Deputy Hospital Director of Clinical Services, Dr. Kevin Mponda, thanked Go and partners for the donation. He says Kwech is still fighting the pandemic as people are still testing positive for the disease, hence encouraging people to continue following the preventive guidelines of keeping social distance, wearing masks and washing hands with soap.
So our inpatient admission numbers, as I speak now, we've got about 15 patients in our COVID wards. As you know, this is markedly lower than a few months ago when we used to have 100. But we're still seeing, we're still running tests every day, about 200 tests daily. And we're still having patients coming in testing positive with symptoms that we treat, and they go back on the same day. Queens, as you know, has been battling COVID for so long. We started COVID since last year. There have been waves, but we have remained with patients that we are still managing.
The ECHO-funded COVID-19 prevention program targets the expansion of support to at-risk districts and communities in Malawi to prevent, rapidly detect and effectively respond to COVID-19.
The Malawi Defense Force MDF officers have started getting vaccination of COVID-19. Senior officers on Wednesday led by example by getting their jabs of the AstraZeneca COVID-19 vaccine at Kamuzu Barracks in Lilongwe. MDF Land Forces Commander Major General Chikunkasoko, Sergeant Major Sale Musa and Air Force Commander Major General Ian Chirwa got theirs at the barracks with several officers afterwards. Major General Soko says before protecting the people, the officers need to protect themselves. As such, it is crucial for the officers to be vaccinated.
Because we say if you are to protect your people, you yourself should be safe. You should be healthy. So this is very crucial and very important to the Malawi Defense Force personnel. And really would want everybody to discard the conspiracy theory to say COVID-19 vaccination is dangerous. But indeed, it has not been proven like that here in Malawi. So let's go for it for the safety of our country so that people are healthy and they should be able to go about doing their own business in a safe environment.
Also commenting on the same, Chief of the Malawi Military Health Services, Major General Dr. Chitsabanda, says the vaccination is targeting over 9,000 troops. Minister of Agriculture, Robin Lowe, has indicated that the country is this year expected to produce 122 million kilograms of tobacco, a lower volume when compared to demand of the crop, currently at 132 million kilograms. This came out when the government was signing an agreement with tobacco buyers on grade minimum prices, which commits to buyers not to offer tobacco growers anything below the agreed prices. We have more in this report.
Speaking in Lilongwe after signing the agreements with the tobacco buying companies, Lowe said Malawi's tobacco production has been plummeting over the past 10 years from 400 million kilograms in 2010 to 122 kilograms this year due to poor prices. He said government expects better prices this year as the anticipated production of 122 million kilograms is far below the 132 kilograms required by international buyers.
For sure, we should expect a good season this year because you may agree with me, if supply is low, definitely demand should be high. There will be kind of a scramble in the market to make sure that the little volumes we have, buyers are able maybe to give good prices. That's the assumption. But as government, that's why we came to make sure that we have an agreement of minimum prices to be respected.
Alliance One Managing Director Hugh Saunders urged the authorities to manage the expectations of the growers ahead of the forthcoming tobacco selling season, saying demand could be lower than what government has indicated.
The Minister mentioned that he expected a very prosperous and successful season, and we all hope that is the case, but he was basing his opinion on the TC records of showing 133 million kilos demand and only 122 million kilos production, which would signify that demand is exceeding supply. And therefore, what I asked was that for those figures to be re-looked at, because it's not what we believe the demand to be.
Tobacco remains Malawi's top foreign exchange earner. Last year, Malawi produced 112.89 million kilograms of tobacco and earned $173.5 million, which was 27% lower than the $237 million realized in 2019.
High Court Judge Redson Kabindu has adjourned to April 6th a case in which former Army Commander Henry Odilu and 3 others are being accused of fraudulently paying 2 billion kwacha to a company called Tuso Group without an existing contract. The state, through Special Prosecutor Kamdoni Nyasulu, paraded the last witness, Chief Investigations Officer Flores Pili, who went through several documents including caution and interrogation files of the accused brought before the court. Pawel Nkutabasa is the defense lawyer.
The prosecution called its last witness, but because of time, because the judge is engaged elsewhere, they just finished the examination in chief, and the matter has been adjourned to 6th and 7th April for cross-examination. Mr. Kampasa already testified, and when the witness came today, he was trying to tender a witness statement of Mr. Kampasa, so we objected that this witness already gave oral evidence in court, so we saw no basis why we should have other pieces of evidence being brought to court. So the objection was sustained. We are expected to start cross-examining the witness, and possibly after the end of the cross-examination, we have indications from the state that they'll be closing the case.
You're watching news at 8 on Times Television, TTV, and Times 360 Malawi Facebook page. We'll be back after this short break.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.